Hello and welcome to Dr. Carri's Clinical Corner. And today I'm going to talk about bladder urgency, but a little bit on a personal note. So in the last few months, I've noticed I have some bladder urgency. No leakage, nothing. I'm fine, but I'm why am I having bladder urgency? And so I thought about well, let me share with my audience what I do, what I notice, right? Because I talk about this every day with people. And so a couple things I notice is usually happens when I'm anxious, right? And I would say majority of my patients who have bladder urgency are anxious people. And then obviously the bladder issues create more anxiety. It's sort of like this self-feeding cycle, which I tell everyone we got to break the cycle. So that's the number one thing. It usually happens when I'm anxious. And what happens when we're anxious? Everything tightens, right? And so the number one thing for me that's helped is relaxing my lower abdomen. I'll notice oh my God, I'm holding in my lower abs and everything's tight around the pelvis and the bladder, right? And so I have to consciously relax it, and it eases that urge sensation, which this is something I teach my patients every day. It seems counterintuitive because all we're taught is do Kegels for bladder stuff, right? But if the muscles are squeezing around the bladder, it gives the bladder the sensation that it needs to pee, even if it's maybe not full. If it is full, that's normal, but it might give it extra urge if the muscles around it are tight. So for me, that's been the most helpful thing, is to relax my lower abdomen, which probably also relaxes my pelvic floor and gives the bladder more space to exist. And then with that, I try to do deep breathing, which is helpful for so many of my patients. That's probably one of the techniques that helps the most, is practice some deep breathing. And again, that sort of helps number one, and number two, it helps the anxiety, right? And then it helps the tightness and the tension to relax. So that's what I do. That's what I found in myself. And that helps me a lot. And then I also notice when I'm less stressed and not anxious, I don't have urgency. But let me just tell you a few other things that, I teach my patients. So yeah, breathing is usually the best thing that helps people. Can you stop? Can you take a few deep breaths and relax? You can try to do a few Kegels. So that sort of sends a signal to the bladder hey, it's not time to go yet. And if your pelvic floor muscles are tight, that will help it relax by sort of giving it that contrast of squeeze, relax. You can sit, you could cross your legs, sort of pressure. I think those are things that we normally do. You can distract yourself, so that also really helps. I feel a lot of times when I've had urgency, it's I'm driving in the car and on my way somewhere, right? Or I'm, somewhere where the bathroom's not readily accessible, which is why people get urgency and they get anxious, right? And that's sort of what feeds into all of this. So distraction is another good one. Okay, let me think about something else. And then that also helps me too. So those are kind of the top things that I tell people. Take deep breaths, sit, cross your legs, distract yourself, do a few Kegels, but try to relax, right? And it seems counterintuitive. Try to be in control. Try to walk to the bathroom normally, not rush. And those things help a lot. I know it seems simple. But I teach this and a lot of other things to help your bladder, urgency, frequency, bladder leakage. I made a whole online course about it. You can watch this other video. I'll link it to this other video that will sort of take you through everything and teach you a couple other things that I teach people, preview a few other free tips besides what I teach in the course. But in the online course, I have 30 videos that teach you all kinds of scenarios, what to do, because it's not about Kegels, or Kegels are a very small piece of it. And this is what I see in the clinic every day. This is what I built my course on, is what I see in the clinic. And Kegels help a little bit, but it's all these other things, right? Most people, once they learn Kegels, they can do them, but it's usually all these other things that contribute to urgency, frequency, bladder leakage. And again, for me, it was not doing Kegels, right? It was the opposite, actually. Like, the thing that helped me the most is relax my lower abdomen, take some deep breaths, and distraction was like the third thing that helped me. So if you want to learn more, I'll link that below. Sign up for that free class to kind of learn a little bit more. Yeah, but there is help. There's things you can do, and Kegels are probably not it. Okay, follow along for more.